We can address the cost issues, and there are ways to do that. But we get on this slope of telling people.
When you say that the government's going to tell an 85-year-old grandmother, sorry, you can't have a hip replacement, where is that in the legislation? I mean, where does it say the government's going to tell your grandmother whether or not she can get a hip replacement? I don't see it in either bill.
Oh, yeah, of course you don't. Yeah, there's a little thing called implementation. Have you seen the flow chart that's come up on the bureaucracy that's going to be created? All the various levels of government agencies and entities are going to have a hand in this, how an independent group of people are going to sit back and make decisions about health care coverage. Of course, you're not going to spell that out in the legislation, but you can read and know where this thing is going. And the reality of it is part and parcel of what people are talking about, what people are concerned about. So to this point, whether or not it's in the legislation, it is a concern that I've heard and a number of people have heard around the country that needs to get addressed. And I don't think this administration can look the American people in the eye and tell them that 3-4 years down the road that the federal government, very much like it has with Amtrak, set up a monopoly in health care and have the ultimate control of the outcomes of what you get, where you go, and how you receive that health care service.
I want to point out, though, we're still talking about the fact that people will have a choice. They won't be told to go one way or another. Final question.
I'm
curious.
Can I be honest? I don't know that. I don't know that. I haven't seen the final bill. I don't know that.
Question for you.
You don't either.
What kind of health care do you have?
I have health care through the RNC. But I was a small businessman and had to pay for this myself at one time, so I can tell you from firsthand experience what it's like to be able to go into this market and have to spend over $20,000 a year to provide health care for my family. So I understand the cost side of it.
But are you happy with your health care?
I'm happy with my health care, just like 85% of the American people.
So you're satisfied with your health care?
But I am concerned about the cost, just like I'm sure you are.
I think we're all concerned about it. All right. Any final thoughts,
that's
Elizabeth?
the bottom line.
I think, you know what, sometimes this comes down to the haves and the have-nots. He just told us he's a have. He's got great health care. What about the people who don't? And that's what health care reform is about, as well as containing costs.
Chairman, final thought.
Million, but that's 47 million out of 310. All right? So don't paint this picture like, America's, 90% of our people don't have health care. That is not the case. We have a small segment of that community, 12 million of whom are illegal immigrants, 10 million of whom or so are qualified for Medicaid and Medicare already but don't know it or have not gotten onto the program, a significant number of our young people. So that 47 million number looks a little bit different when you get behind it and see who those people are and what their situation is.
Chairman, before I let you go, because I'm just curious, Elizabeth and I both were wondering, what type of health insurance do you have? Do you get that through the RNC?
Yep, through my employer.
What company is it?
Blue Cross Blue Shield, I believe.
All right, Chairman Michael Steele.
Or maybe not. I'm not
sure.
I think it's Blue Cross Blue Shield.
You must be.
Yeah.
You must have gone to the doctor lately. You're in good shape, Chairman.
I haven't had to use the plan too much. Thank goodness.